Hi everyone, thank you for joining me on today's Ask the Egg Whisperer. We're living in unprecedented times. I know I'm not telling you guys anything that you don't already know, but I think it's hard. It's hard for me, to wake up each morning and be like, okay, I got to give it my all, and I need to show people strength and resilience. And so I want to share with you, whether you're just a friend from high school watching me saying, hey, I wonder what Aimee's up to today on her Instagram Live. I think it's important to kind of think of ways to find joy in each and every day. And I want you to know that it's okay to find joy. It's okay to feel like you want to be happy with what we're facing right now. And I just want to share just a few tips for you. I know that you're probably like, Aimee, that stuff is so obvious. Why would you even say that? But sometimes the most obvious things aren't obvious, and they're really simple ways. So I'll just share with you stuff I do. Number one, I listen to house music. It makes me really happy. So find music is, what is that? It's like the voice of our hearts. And so finding songs that can, get you through your day, those moments, really helps. Other things, finding a mantra. So finding a saying. It's kind of like finding a happy place. So if you don't already have one, just find one. And sometimes I see things online, I'll take a picture and I have a folder on my phone. So when I'm feeling kind of down or maybe a little bit anxious, I just go to that folder and I just read these things that make me feel really calm. Find a breathing practice that really works for you. So Josephine At-Lurie, for example, is a meditation teacher, and she can teach you, if you don't already have a meditation practice, exactly how to meditate and breathe. I have my Apple Watch, one of my, it's what I asked for from Santa, also known as my husband, and he got me one of these, and this is my third watch because I have a tendency to lose things. He knows that very, very well. But the cool thing about it is it reminds you to breathe and actually takes you through breathing sessions. So it's a really useful tool to have if you don't. So music, breathing, and then connections with other people, other humans. So if you're feeling lonely right now, it's super important to call your friends and just tell them you love them. It's as simple as that. Hey, I love you. And actually just talk to them on the phone. You can text them too. But I think talking and finding human connections is very, very important now than ever. Loneliness is legit. And it's legit in that it makes us feel really sad. And I feel like there's a saying that I'm going to come up with really, really soon, but I can't figure out what it is. And it's something along the lines of I was about to say, if you're happy and you know it, clap your hands. But that sounds kind of not what I meant to say at all. But what I was trying to say is I feel like if you're going through fertility treatment and you feel excited and happy, you're going to be, no matter what happens, in a much better place mentally if it doesn't work. Because at the end of the day, a lot of treatments don't work. So it's not happy person, happy eggs. That's silly. But it's if you're finding joy as you're going through this journey, then perhaps no matter what the outcome, you're not going to be as overwhelmed, anxious, and depressed. Because right now, what everyone is going through each and every day, more so than ever, January 2021 is probably going to be the hardest month of, most people's lives in this country, especially because we've never faced famine, we've never faced war in the way that a lot of people in other parts of the world have faced. So dig in, get in your AirPods, start listening to your house music, go outside and take a walk, and call your friends and tell them that you love them as you're breathing and thinking about your mantra. Okay? So I hope that helps. So now we're going to start answering your questions. So thank you guys for submitting your questions. You can go to asktheeggwhisperer.com if you're I'm curious what Aimee has to say about me. So this first question is from, and she named herself Confused About Meds. So, hi, Confused About Meds. Here we go. I'm 41 years old and hopefully will become a single mom by choice. Fingers crossed. I'm just starting my journey and plan to start IVF within the next few months. All tests and labs are good to move forward. My clinic emailed me my protocol along with a list of medications and have no idea what they do and or if one is preferred over the other and why. Since my insurance doesn't cover it, I'd like to know what options are there to purchase. Please help. Here we go, you guys. Cetrotide or Ganirelix, Gonal-F or Follistim, Novarel or Pregnal, Omnitrope kit, Leuprolide kit, Estrace, Dexamethasone. Okay, well, this is really fun. I actually have a show all about IVF stimulation medications. It's on my YouTube channel, so go to Egg Whisperer Show in YouTube and you'll see that show. But in the meantime, let's break this down. This is a really good question. So Cetrotide and Ganirelix are basically the same medication made by two different companies, and they prevent ovulation. Cetrotide comes as a powder vial. You have to turn the dry into wet to make that work. Ganirelix comes in a pre-filled syringe ready to go. You just pop off the cap and inject. You know, honestly, they're both about the same price. I prefer ganirelix just because it's pre-filled, ready to go, and you don't have to mix an extra powder, and there's lots of packaging in the Cetrotide. But honestly, they're exactly the same. So Cetrotide actually is kind of cool too if you really like to line up all your vials, and you can mix your Menopur in with Cetrotide and just treat it as an extra Menopur vial. So honestly, like, doesn't matter. So if price isn't an issue, meaning like you have to pay cash and you're trying to choose between two and you want to pick the better one, they're both the better chicken. You know, from that's a reference to a movie, and I can't remember. Father of the Bride, the cheaper chicken. They're both fine chicken. So Gonal-f or Follistim, also same idea. Some doctors feel really, really strongly about one stimulation medication over the other. So Gonal-f, like one's a blue pen, one's a white pen. I mean, they're both basically the same. Follistim, a little bit more handling is needed. You have to load the cartridge into the pen, screw it on, attach the needle. Gonal-f, the medication's already pre-filled, but I've seen people push a little bit too hard on the end there and break it, and you can't break the Follistim pen. But honestly, like, either way, it's fine. And if you're worried about breaking the pen, you can also get the multi-dose Gonal-f vial. Novaral, Pregnal, it's like saying HCG or HCG. They're basically the same. There's no difference there, just a powder that you turn the dry into wet. Omnitrope is the HGH, so that's what I use for priming in some cases, and as well during the cycle to potentially help with egg quality. The Lupron kit, I can't believe I just said that. Kit is the Lupron kit. Can be used as part of your trigger shot, and I imagine that's probably why your doctor's ordering it for you, because you already mentioned the Pregnal and Novaral. And then estrase can be used for priming and to thicken the lining of the uterus, and dexamethasone is a steroid. It might make you feel kind of crazy in your you might want to wake up at 2 a.m. and like go to your neighbor's house and start waxing their cars because you're so hyper and you can't go to sleep. So if that happens to you, be sure to take it first thing in the morning, okay? And then cut it in half if you're still feeling wired. And then stop taking it if you like have cleaned all the cars in your neighborhood and you still can't go to sleep. I'm telling you that because I literally had a patient once who told me she took the dexamethasone and started waxing her cars after she washed all her windows and washed all her curtains and ironed them and still couldn't go to sleep. So I'm just warning you about how the dexamethasone will make you feel. So the next question that Confused About Meds asked is it best to wait a few months or more to make sure I get the best quality eggs or just move forward ASAP? Thank you for your insights and recommendations. So you're 41 years old. My approach is to take a look at your hormone levels, look at the follicles, and just say, like, are these follicles, like, is this number really great for us to move forward with? Or does it make sense for us to wait a month to, maybe we might get a better egg count next month. But if your egg count is fabulous and your doctor is really happy with it, and let's say it's consistent with your AMH, for example, go for it. Otherwise, I'll just give you a scenario. So let's say your AMH level is 0.9, and I've seen you before and your follicle count was like 13. And you show up when we're about to start IVF and your follicle count is like 7. And I'm like, hold on, like just the other day we were at 13, like last month. Like, let's wait another month and see if next month is going to be better. And we'll make a deal. I'll be like, let's make this deal. The deal is if your follicle count is the same as last month, we'll just go for it. But if it's higher, we'll be like, oh, thank goodness we waited a month. See, your eggs don't disappear overnight. It's over time. And when you're older, though, especially if you're over, let's say, the age of 42, sometimes the over time can be a shorter amount of time, like 3 months or so. So I would say if you see a really nice cycle, I would take advantage of it while it's there and don't think that it's always going to be there. Because sometimes you show up, it's a good cycle, you wait, and you find out that the egg count's lower, and then you'll be kind of bummed that no one kind of talked to you about moving forward when you had a good egg count. Okay, now we have Fernanda's question. Fernanda says, we've been trying to conceive for over 5 years now. Everything seems to be fine with us. The only thing left for us to do is for me to have surgery to check for endometriosis. Is this something that you would recommend? Thank you so much. So Fernanda, I'm just going to use this opportunity to talk about the TUSHY check, right? So these are the 5 tests that you do to check your fertility. If it's been 5 years, I don't know when the last time you had your TUSHY checked was, so perhaps it makes sense to do it again. So check your tubes, look at the uterus, make sure that there's no adenomyosis, for example, polyps, fibroids, septum. Look at the sperm quality again, maybe do a sperm DNA fragmentation test. Look at all your preconception labs, including hormones, not just the FSH, estradiol, AMH, but also look at your thyroid, your vitamin D, and your prolactin. And last but not least, make sure you've done enough genetic screening, chromosome analysis, and carrier screen for both you and your partner. Because this is the deal. Sometimes you might find out that you have I've seen this before. You've been trying all these years, everyone says everything is normal, and it turns out you have a balanced translocation. And you find that the hard way after you've gone through an IVF cycle to find out that none of the embryos or very few of the embryos had normal chromosomes. Or you find out that the sperm DNA fragmentation was really high and you could have been doing something the whole time to fix it. So I just kind of said something that I didn't mean to say, but what I meant to say was if the sperm quality isn't good now, and it has been in the past, then doing the sperm DNA fragmentation might be something that would be helpful. And then you guys all know my egg whisperer golden rules, and I don't know how old you are, Fernanda, but if you've been trying for over 5 years, I imagine you might be over the age of 32. In a case like yours, depending on how many kids that you want, it might make sense to save the eggs. And if you want, save embryos too, or just save embryos, if you're partnered. I think we do a really good job talking to young people, especially women in their 20s and early 30s, about freezing eggs, but we don't do enough about people who are partnered, especially people who have been trying for 5 years, about how IVF can help you preserve your future, I almost said something else, fertility and secure options for yourselves in the future. Okay, so this next question is from Felicia. Felicia says, "Hi, Dr. Aimee, and as always, thank you. I'm 37 and I'm experiencing secondary infertility." For those of you guys who don't know what secondary infertility means, it means having a hard time getting pregnant when you've already had one baby. My husband's semen analysis came back good. I recently did 2 unsuccessful IVF cycles. I have a blocked tube, which I'm getting a laparoscopy for in March. They think I might have endometriosis, and I'm hoping that my tube can get unblocked. Before I continue, Felicia, what I'll tell you is that it's really important for you to talk to your doctor about the likelihood of unblocking a blocked tube, especially if there's endometriosis. And the reason why I say that is it's very unlikely you can unblock a blocked tube. The diameter of a tube is kind of like the diameter of a strand of hair. And imagine, have you ever done this? You walk and then you step on some gum and then it's stuck on the bottom of your shoe. Or actually, that's not a good analogy. How about this? You're looking at the sidewalk outside and there's little gum remnants just everywhere. When people are just spitting out their gum. I don't know who does that. Seriously though, who spits out their gum and doesn't put it into a trash can? But people do that, right? And you can see the gum outside on the cement. It is impossible to get that gum off. So that's the same idea as far as and I don't know if that analogy really makes sense, but come on guys, you know what I mean. It's really hard to pick that gum off. And so if a tube is blocked, the inside of a tube, it's all sticky in there. You can't peel it out because again, the diameter is the strand of hair. So sometimes though, there could be a little bit of scar tissue. You just clip it and then all of a sudden the tube is voila, open. But for the most part, it doesn't work like that. Here we go. More from Felicia. My doctor said that I have an egg quality issue. I did 2 IVF cycles, as you know, and I did not get any embryos to grow past day 3 both times. At this point, IVF is too expensive. What are your thoughts on trying letrozole after my laparoscopy? I did a little research and found that it might help with maturation and egg quality since that is my issue. My second IVF was a Lupron flare, which was worse than the first, so I wonder if IVF was too aggressive for me. Okay, Felicia, here are my thoughts. I'm not sure how much more you want to do as far as IVF goes, but I don't think IVF as an aggressive thing. I don't think of it like that. IVF is what will give us the highest chance of pregnancy, aside from trying. There's nothing that gives us the higher chance than IVF. But my thought process, or what I want to convey to people who are listening to Felicia's question, is this. Just because you didn't get pregnant from 2 IVF cycles doesn't mean you can't get pregnant with other things. And sometimes, I like her question because she's saying, hey, I want to take a step back and see if there's anything else I can do other than IVF. And I think sometimes people aren't given that opportunity and chance to do something other than IVF after they've gone through the IVF that doesn't work. And I actually think it makes perfect sense to do that, especially if you have a blocked fallopian tube. That tube might be impeding your chances of having a natural pregnancy. So I would say go for it. You have my complete blessing. Not that you need it, because you guys know that I'm not anyone's doctor here. I'm just here just kind of having fun, talking about fertility, presenting different ideas and thoughts to anyone and everyone who's going to listen. And, I get excited to do that every day that I'm here. But I think in your case, Felicia, it makes perfect sense. Do that laparoscopy, but don't be surprised if you wake up with that tube disconnected. You don't need a fallopian tube to ovulate eggs, but obviously you'll need a fallopian tube to get pregnant from that side if you're going to ovulate from that side. And I think taking a medication like letrozole, which those of you who know what letrozole is, also known as Femera, taking a higher dose, perhaps maybe 4 tablets per night for 5 nights starting cycle day 2 or 3, could help you ovulate on the side that does not have a blocked fallopian tube. And what I tell people is this, and it sounds super annoying, but I'm sorry, I'm going to be super annoying here for maybe the rest of this Ask the Egg Whisperer show, but I'm going to tell you, when 2 people love each other, obviously you have to be in a heterosexual relationship. When 2 people love each other, magic can happen in the bedroom. Obviously magic can happen in the bedroom if you are in a homosexual relationship, but follow me here. And sometimes the impossible can be possible. So even when you don't have a beautiful embryo from 2 IVF cycles that doesn't work, doesn't mean you can't make one at home. Okay, so it just takes an egg, a sperm, and at least 1 fallopian tube that's open to get pregnant naturally. And as long as you have that hope in your heart and that love for your partner, and you guys are having sex, right? I mean, it does take having sex, duh. You guys still have a chance. So I like your idea, Felicia, and what you're thinking about, and I would say go for it. And if you are still open to doing more IVF, it might take 1 more cycle to get there. Maybe consider taking some of the supplements that I talk about a lot on the show, and maybe that can help you, and talk to your doctor about other protocols as well. So this next question is from Leanne. You guys, Leanne likes my sense of humor. She starts off by saying, "Hi, Dr. Aimee. I adore your sense of humor. I feel like we may be kindred spirits." That's really sweet. Thank you, Leanne. "I'm heading into my 5th IVF cycle next month and want to make sure we're doing everything possible for our final attempt. I'm 38. My 3-year-old daughter is a result of my 2nd IVF cycle. My AMH has been around 1 for the past 5 years. FSH is 9 to 10. I've done short protocols for all my cycles, but although my AFC was 7 to 8 for my 3rd and 4th, we only retrieved 3 eggs both times. Only 1 egg fertilized, and we transferred the only 1 untested blast in cycle 3, and this embryo, in the next cycle, it looks like I also did another transfer. I'm skipping around, guys. My apologies. Neither of them stuck. For this cycle, I'm priming with testosterone. My doctor has recommended switching to a long protocol. Do you agree it's worth a shot? I've heard all the bad press for Lupron. Just to mention, my husband has hypopituitarism. Although his sperm analysis looks great on paper, do you think this also might be causing an issue? Many thanks for your input. I love watching." Okay, Leanne, thank you for sharing this with me. Okay, here we go. When you're using medications like Lupron, what is that doing? That's like suppressing your ovaries. It's like telling your ovaries, shh, 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 right? It's like, zip it, ovaries. And my concern when you're sharing a story of having 7 to 8 follicles and only getting few eggs out, doing that might be too suppressing on your ovaries. So I would be really careful and talk to your doctor about what that baseline count looks like, and saying, look, let's just start meds and see what happens, and be open to different possibilities. Like if you did the testosterone and then did all the Lupron and then found that your ovaries were like snoozing a little bit, that's not what the ovaries sound like, guys, just so you know. But if your ovaries are taking a little bit of a snooze, maybe say, let's just start meds for a few days, and then not necessarily commit to completing the cycle, but commit to learning from how this approach might work for me. And then as long as your husband's sperm is good, total mole count is at least, my goal is at least 10 million to do an IUI. You can always do an IUI as long as your fallopian tubes are open. So it's not a wasted cycle. But I would be really careful about suppressing your ovaries in someone who has a higher egg count at the beginning of the cycle and ends up with much fewer eggs. That would be the concern that I would have. And it sounds like, Leanne, you probably know all the egg quality supplements that I talk about always. So be sure to talk to your doctor about adding them, as well as seeing if HGH is an option for you. And just a couple little tips for you to talk to your doctor about in patients who have, let's say, 8 follicles and get 3 eggs. Consider growing them just a little bit bigger, maybe taking a little bit higher of a trigger shot dose, and maybe triggering it a little bit later than 36 hours, maybe 36.5 hours if your doctor feels comfortable doing that, okay? As long as your doctor isn't concerned that the reason why you got fewer eggs is because you might have ovulated, and I'm sure they would have been transparent in telling you that, okay? Thank you, Leanne, for those questions, and I wish you all the best for your next IVF cycle. This next question is from Kelsey. Kelsey says, "Hi, Dr. Aimee. I've been diagnosed with unexplained infertility." You guys know my eyes are rolling. I'm just kidding. I'm going to help you. Let's see what we can figure out, you guys. Let's go. Here we go. "All my tests came back normal. I do have a thyroid issue, No. I do have a TSH that was within the normal range, in the upper range of 3.4 to 4. I've been struggling to manage my TSH with Synthroid to be in the 2.5 or lower range. I need to have my TSH tested every 6 weeks. I have been needing to increase my Synthroid dosage regularly. My GP has diagnosed me with Hashimoto's despite never obtaining any other blood work other than TSH. I've been fighting for actual antibodies. So I'm getting a second opinion from another doctor. From a fertility perspective, how important is it that I know if I actually do have Hashimoto's for pregnancy and fertility? Could a reason why I cannot get pregnant despite all the tests and blood work being normal due to an autoimmune disorder if I do in fact have Hashimoto's? Okay, Kelsey, here's the deal. What is your prolactin? Right? So if you're like TSH, if you're having a hard time controlling it, you might have an issue with your prolactin level as well. So definitely check your prolactin. An antibody test, so easy to do. You guys, I don't know where Kelsey lives, but in this country, we have access to websites where you can just order tests without a doctor's orders, and they're relatively cheap if you don't have the ability to use your insurance in that kind of situation. So I'm not encouraging anyone to take things into their own hands, but sometimes when it's time to take things into your own hands, it's time to take things into your own hands. I said that 3 times, but I think you know what I mean. So it sounds like, Kelsey, you and your gut think that you need to get the antithyroid testing done, and I would agree. I recommend a full thyroid panel. I don't know how much of what's going on is related to your fertility, but I feel like getting that information is really important, and I would recommend making sure that your antibody levels are stabilized and not going up, up, and up before you get pregnant. That's something that's important to me when I take care of my patients. And I did a really cool cure talks with a thyroid specialist. Her name is Dr. Christine Marin. You can probably find it on my blog, draimee.org, or go to my YouTube channel and just look at Cure Talks, and you'll find it that way. You'll find all the Cure Talks shows and interviews that I've done. And she did a fabulous one about thyroid, fertility, diet, exercise, all that kind of stuff that I think might be helpful for you to know. And then again, just like I said to Fernanda earlier in this show, if you've truly been given the diagnosis of unexplained, do everything again. I think sometimes we rely on these little snapshots, and it's like, oh, in this snapshot of time, in this one cycle, the FSH was 8 and my AMH was 2. But if you did it, let's say 3 months later or a year later, you might find that the AMH actually, that was a lab variation. It wasn't truly 2, and the FSH is now 13, and that tells you what the explanation is. So I'm not saying I hope that to be the case for you, but I just don't want you to rely on old data to assume that things might be reassuring when there might be a sign that there's certain actions that you can take in addition to tracking and trending your thyroid levels. But I think you're doing a great job with everything that you're doing, and the answer is yes. If you have Hashimoto's and you have antithyroid antibodies, you might be at higher risk of having antiovarian antibodies or anti-adrenal antibodies. So there could be other antibodies that could be positive as well. This next question is from Marina. Marina says, hi, Dr. Aimee. First of all, I want to thank you for helping so many people. You're amazing. And Carolina says, hi, Dr. Carolina Sualdo. Hi, Carolina. I'm 39 years old. I've been trying to conceive for 2 years. Fertility workup did not reveal any major issues. My AMH is 0.81. I have a uterine myoma, but HSG test revealed that it would not cause any issues. I have a benign elevated DHEA. It's 700 to 900. Adrenal and ovarian issues have been ruled out. My husband's 32. His semen analysis was normal, except the concentration is on the borderline of being low. We've tried 2 IUIs, both failed, and just recently went through 2 IVF cycles, first with gonal and menopur, second with gonal, menopur, and Lupron. Both had no more than 6 eggs retrieved, with 2 making it to blastocyst. I had to transfer 1 that was frozen from the first cycle and 1 fresh day 5 embryo from the second cycle, and neither resulted in a pregnancy. We feel defeated. We have no more embryos left. What would you recommend our next step to be? Thank you so much. Okay, Marina, here's the deal. You're 39 years old. What you're going through is normal. The beautiful stuff, like the stuff that I'm like, here's the positives. You're still making blasts. You're still making embryos. You're fertilizing eggs. Like, that's awesome. You know, we all get to the point where we don't make any mature eggs anymore. They don't fertilize, and they don't turn into embryos that grow. So the fact that we still have a chance of pregnancy at 39, like, that's what I want you to remember in here. I think sometimes we just assume that it's due to our age, and we miss other tests that we could possibly do. And I know you guys hear me talking about these other tests, but I think Even in a case of a 39-year-old, I would still say, let's check a chromosome analysis because we haven't genetically tested these embryos. We don't know if they're normal or not. So do that next. Take all the egg quality supplements that I talk about. Make sure that you're in the best shapes of your lives. I do this thing with my patients. I think it's kind of funny, but I mean, I think it's funny. I'm not sure if they think it's funny, but no one has gotten mad at me yet. I'll see a couple and it'll be like, you look like, and I think of like a couple that's like, you know, super cute. And I think of my couples, like my patients, whether they're coupled or not, is super cute. I'll be like, you look like J-Lo and A-Rod, or you look like The Rock. You know, it's like channel that, like have that goal in your mind. And what I'm saying is I want you to be the healthiest versions of yourself. Okay? Literally. Put the beer down, close up the pizza box, and look up how to eat healthy. I know I'm on a tangent here, but foodfuels.com is one way to do it. Mind Body Nutrition with Judy Simon is another way of doing it, and she has some virtual classes coming up for you guys to sign up for. But I think looking at the things that you can control within yourselves, like how you eat and how you live your life, is really the only thing that we can do. And at the end of the day, your eggs are going to be the way they are, and we can't like control that stuff. So I would say the fact that you haven't had success yet doesn't mean that you won't in the future, but I would say that it would make sense maybe when you get another embryo to freeze it, maybe do some implantation testing before you transfer it. And if you were a patient of mine, I would have you actually consider genetic testing of the embryos, just so you have the answer. I think it's really hard to like not have success and then be like, why? Like, why didn't this embryo stick and grow? And sometimes even embryos that have normal chromosomes don't. But if the embryo didn't have normal chromosomes, at least you wouldn't put yourself through a transfer that had such a low chance of working. So those are the kinds of things that I would consider. And then the other thing, I know you guys all know my methods. You got the TUSHY method, I already talked about that. But I would really look at the sperm. I mean, you gave us some information here, and you said that the sperm quality was on the low end of normal. The concentration was low. So go through the balls method. Look at his testosterone level, see if he would benefit from something to increase his testosterone, like Clomid, Arimidex, Gonal F shots, HCG shots to build up his quality. Rule out a varicocele as another example. Do a sperm DNA fragmentation test. Make sure everyone at home is sleeping well, enough 8 hours of sleep, getting exercise most days of the week. I mean, all those things can help with testosterone, help with sperm quality, so that your embryos will be, or your eggs will be fertilized with sparkling sperm next time you do an egg retrieval. So sperm does matter. Don't let anyone sugarcoat those sperm results and say things like, oh, it's low, but it's probably just fine. Well, I mean, it could be just fine, but prove it, right? Like prove it that it's going to be just fine. And then ask your doc and see if they have extra tools in the lab, like a Zymote chip or Pixie, to pick out the best sperm before they fertilize your eggs for the next cycle, if you choose to do one. Thank you for your question. This next question is from Shannon. Shannon says, hi, Dr. E. I realize this may be a somewhat, here we go, controversial question, but I hope you can help. What is the shortest time frame that you can improve egg quality? I recently switched clinics, and my previous doctor assured me, despite my consistent concern and hesitation, that I can continue the use of medical marijuana. My mother calls it marijuana. It's very annoying to be around my mother. She says things like, who won the presidential erection, and marijuana. I mean, it's like so weird, but that's welcome to my life. So when I see that, I just have to say that. Without any negative impact on my eggs. My new doctor, of course, advised me to discontinue use and opt for a different treatment option for the time being. I'm worried about my egg quality going into our next cycle. Have I severely damaged my eggs? Is there a way to improve the quality of my eggs quickly within 3 to 4 weeks for my next cycle? This has caused me a lot of upset and anxiety, and due to lack of research, I haven't found many answers online. And my doctor is out of reach because of a vacation. Thank you for your help and all you do. So Shannon, I wouldn't sweat it, literally. I wouldn't. I worry, I'll just tell you what I worry about when it comes to THC, CBD, is how they bind to receptors, let's say, in the lining of the uterus and affect implantation, and how they affect potentially tubal motility when trying to get pregnant naturally. I absolutely don't think that means that you should restart now that you're planning this IVF cycle, but I also don't want you to marijuana shame yourself one bit. So don't sweat it, don't worry about it, just take your CoQ10, your NAD, your prenatal with fish oil and vitamin D, and do your cycle with an open heart, and don't shame yourself, and just move forward and don't live in the past. Don't sweat it, okay? This next question is from Muna. Muna says, hi, Dr. Aimee. I'm 41 years old. I did 4 rounds of IVF. The first cycle was when I was 40. I used 300 of Follistim, 150 of Menopur, and HGH. 14 eggs were retrieved and only 4 embryos, 1AA, 1AB, 2BC, and all of them, none of them stuck. I only had 1 normal embryo and none stuck, sorry. In the second cycle, same protocol, I got 11 eggs, ended up with 4 embryos. That cycle, my estrogen level went down before the trigger shot from 3,400 to 2,700. My third cycle was a mini IVF with estrogen priming, no HGHs, Clomid, and 175 of Follistim. I also started True Niagen after seeing one of your videos on YouTube. That was my best cycle yet. 10 eggs retrieved, 5 embryos. Of them, I only got 4 abnormal and 1 did not have enough DNA. In my fourth cycle, here we go, Follistim, Menopur, Clomid, 9 eggs retrieved, 4 embryos, all abnormal, total of 17 embryos, 1 normal, 16 abnormal. Should I continue or give up? Egg donation is not an option. I've always wanted to be a mom since I was a kid. I started to take all the supplements you recommended. I'm planning to add HGH. What's your advice for my next cycle? Okay, Muna, thank you for sharing all of this and everything that you've been through. You're 41 years old, and I know I've said this before. What you've gone through is very normal. It's a typical experience. And I know you guys always hear me say that if you're over the age, especially of 38, let's say you're 39 and over, you should be open to all possibilities of needing to do 4 to 6 cycles to even get 1 to 2 healthy embryos. Okay. That is normal. But what you shared with me is that you have 1 embryo that has not enough DNA. So don't count that embryo out. So I came up with a mnemonic, and that's Embryo Diamonds. So you can go to embryodiamonds.com, and the O in the diamonds is official reports. It's really important when you have someone who's had 17 embryos, 1 normal and 16 abnormal, that you want to make sure that you're not discarding any embryos that could potentially be normal. And what do I mean by that? It's the M word, the mosaic word. Every clinic that's doing genetic testing of embryos needs to make sure that they've communicated their protocol for reporting mosaicism and transferring mosaic embryos. So sometimes patients are told an embryo is abnormal when it's truly mosaic. So in a case like yours, I would make sure that you've done a post-IVF consult with your doctor, post-IVF consult with the genetic testing company, and then if needed, a genetic counseling consultation, a consultation with a genetic counselor to also review the results. Maybe someone who's not affiliated with the IVF clinic or the genetic testing company to give you a completely unbiased opinion. Because I feel like sometimes people are told their embryo is abnormal when they're not because the doctor wants to mislead the patient, but just because they think that it's too much information. It could be confusing for patients, but my patients don't get confused over things that I explain to them in a very understandable way. So that's one bit of advice for you. A bit of advice, again, is before you transfer, I would recommend doing implantation testing. So that's part of my Egg Whisperer diet. I know you guys all know this stuff, but the D is knowing the diagnosis. And in your case, we know that it's being 41. Doing your IVF cycles, and the E is embryo transfer preparation. So continue to take all the steps that you're doing to go through each cycle and figure out what the best approach is, but make sure that you're paying attention to the transfer prep part with the same amount of detail, looking at the cavity, making sure you're in the best shape ever, all that kind of stuff before you transfer. So my advice to you, Muna, is if you're open to doing another cycle, you've already done 4, I think it's okay to try again. I would, however, talk in detail with the folks that I already told you guys about, and definitely add, if you were a patient of mine, I would say definitely add HGH to your next cycle and maybe do it in between as you're preparing for your next cycle. Okay, so now we're moving on to Somaya's question, and she says, hi, Dr. Aimee June. So that's a word of endearment that means my dear. I'm 37 years old. In my recent IVF, we got 11 eggs, 9 fertilized, 4 blastocysts, 3 normal. Now for the transfer. I went on birth control pill for 8 days. I stopped for 4 days, then went again on birth control to do the hysteroscopy, during which a 5-millimeter polyp was taken out. Everything else was fine. I'm supposed to continue birth control pills for 10 days, then start to do the frozen embryo transfer. I did an ERA before with a previous clinic with injected progesterone, which showed my uterus was receptive. My doctor would like to go with vaginal progesterone, not injection. He thinks we're fine without the ERA because my previous ERA showed we're receptive. Here are my questions. Do you think we're fine without the ERA since we're changing the protocol? Do you suggest going without injected progesterone? In my previous FET, my body reacted weirdly to the progesterone and sesame oil. My white blood cell count went up. I felt very weak with body aches. Changing that to ethyl oleate was better, but still weak. Okay, Somaye, it sounds like your doctor is just like me. They're listening to the side effects, they're listening to how you felt, and they're making changes that make sense. If you did an ERA consult with the folks at the ERA testing company, they would tell you something that I would say sounds very politically correct. And I don't know how scientifically accurate it is. I'll tell you that. Asterisks, asterisks. Listen to your doctor. This information is just for information. What should I say? Informational use only. I feel like, those commercials where you're like, this medication could cause this, this, and that. I feel like I need to do a disclaimer here. The egg whisperer disclaimer that what I'm saying here isn't to be taken as your medical advice. It's just, for informational purposes and educational purposes only. The information, Somaya, that your doctor is telling you is exactly what I would do. I would say it sounds like this progesterone oil is just not working for you. If you're feeling super weak and your white blood cell is going up, I would also say let's switch to vaginal inserts, and I would stick to the same protocol that your ERA test said that we needed to stick to. So that's what I would do. I've actually repeated the ERA test with 2 different modes of progesterone administration and gotten the same results. I've had patients who did one transfer and had a healthy pregnancy one way with progesterone and oil, and then we just the next time did it with a vaginal insert and same protocol, and everything worked out great. So I think anecdotally from my experience, I think it's totally okay for you to move forward with a different mode of administration of progesterone and feel good about that decision. However, you have to listen to your gut. And in fact, you have to listen to your uterus. If your uterus is telling you, Somaye, please repeat the ERA test with this different mode of progesterone administration, I would say do it. You can only regret not listening to your gut if the transfer didn't work and you repeated the ERA test and found that your body needed something different. It sounds like that probably isn't going to be the case, but I don't want to make that assumption. But I can just tell you from my experience that if I switch the mode of progesterone administration, I do not repeat the ERA test, but just because I don't doesn't mean that your doctor or someone else's doctor won't. I'm just giving you additional reassurance that I think what your doctor is doing sounds pretty darn fine. Okay, next question is from Emily. Dr. Aimee, your show has been my lifeline during this challenging time of trying to conceive. I wish I had found you 10 years ago. Alas, I have questions now and could really use your advice. My clock is running out and I'm scared. What is your advice for these statistics? I'm 37, AMH is 1.14, FSH is 5.8, follicles 6. Is my AMH considered DOR? What are your thoughts? Emily, having 6 follicles is great. It really is. I would say, and I know I say this a lot, be open to the possibility that if you were to do IVF, you might need more than one cycle to get at least 2 healthy embryos. That's called normal, okay? My suggestion, since you are 37, is to be as aggressive as you feel comfortable being as soon as possible. I wouldn't wait. And I think sometimes people feel like they need to do all this other stuff before they do what's going to give them the best chance of pregnancy. And I can tell you that you don't need to. You don't need anyone's permission to skip right to IVF. I mean, like literally, you're 37, you want to have a baby and you want to have at least 2. We have these procedures in place like IVF, like egg freezing. So you can skip over all the trying to conceive stuff and go right to securing options for yourself for the future. So I would consider embryo banking. It sounds like you've already had a challenging time trying to conceive. Figure out the diagnosis and make sure you've done all the testing ahead of time. And it sounds like you've done a lot of them because you shared them with me. And that's what I would do if it were me. Okay? And I would repeat your FSH, estradiol, and AMH. With a follicle count of 6, you want to see what your AMH level is doing. That's my approach because I find that, and I'm sure you guys can all agree because you hear the stories that people share with me, that some cycles will be better than others. And so I feel like cycles that have a higher egg count can sometimes yield embryos that have better, more embryos, not embryos that are better quality, but more embryos. And it's always nice to do one cycle of IVF. I'm a lot of fun, let me tell you. But no matter how much fun I try and make IVF, it's still a lot. It's emotionally taxing, it's financially taxing, it's physically taxing. So that's why I'm very careful about looking at all the data points with each cycle that I start, and I always make sure I'm communicating all the elements in the Sparkle checklist. So for those of you who just joined right now, you're like, wait. Sparkle checklist, how can I keep up with these things? She has the TUSHY method, the balls method, she just dropped embryo diamonds, and now she's talking about Sparkle checklist. Yes. So those are all the things that you need to know about your follicles with each IVF visit. So you can go to sparklechecklist.com and it should all be outlined there. I better check later and make sure that it's connected to my website. I think it is. But that's what I would do, and I would go for it. So this next question is from Sarah. Sarah says, I recently had a diagnostic laparoscopy where we found endometriosis on the back of my uterus. My fallopian tubes were open, uterine cavity looked clear, and endometriosis wasn't found elsewhere. I'm 28 years old, my husband's 32. We've been trying for 2 years with 2 first trimester losses prior to surgery. This is our first month trying after laparoscopy, and I'm wondering for what you think our chances are to conceive would be now. My husband's last semen analysis post-wash was 14 million with 98% motility and 3% morphology. Mostly curious, what do you think our chances are after removing the endometriosis? Thank you. Okay, Sarah, I'm sorry that you've been through so much. I feel like when someone's young, we need to do more tests than ever. Don't just make the assumption that since you're young, it's gonna happen, just keep trying, you have time. We don't want us to waste your youth making these assumptions when we could be doing tests that might guide us better. Let me tell you what I think you should consider doing. Number 1, let's look at the balls method. Let's look at your husband's sperm and see what we can do to make it sparkle even more, right? His count is a little bit low. We want to see if his sperm DNA fragmentation is normal, if he needs a little boost, if his testosterone level is low, make sure he's on all the sperm-friendly supplements, okay? That's 1. 2, let's look and see, have you guys done enough genetic screening, right? Each pregnancy that you've had is teaching us a lesson and is telling me, pay attention to me, okay? So that's why I came up with the angel approach or angel method. And yes, there's a website, angelmethod.com. But literally, let's go through each of those things. When you've had 2 miscarriages, I want to know why. Like, why someone at 28 has had 2. Could it just be like random? It absolutely could be. But if there's something that we can learn from the miscarriages that you've had, I want to do it. Right now, we can't learn actually from the pregnancy itself, right? We can't test it. But I recommend in anyone who's pregnant who has just found out that their pregnancy is not going to continue to grow because it has stopped growing, I want to actually study the DNA if possible. And there's one company, there's a lot of different companies that you can use, but one in particular is the Anora test. And the company that does it is Natera. I've had patients tell me that their OB/GYN say to them, that testing is too expensive, you can't afford it. I'm like, huh? The test is $200 approximately out of pocket if your insurance doesn't cover it. And I think a lot of people would pay $200 to find out what was wrong with the pregnancy so you can figure out like what your roadmap would look like from there. And let me tell you, the things that we want to do is look at your AMH level to see what's going on with your eggs, right? You're only 28, but we want to make sure that we're not missing an egg quality issue or the diagnosis of decreased ovarian reserve, something that we can definitely deal with at 28, especially if you have at least, in my opinion, if you have even 1 to 3 eggs, doing IVF would make sense, and genetic testing of the embryos to prevent a miscarriage potentially is something that you want to talk to your doctor about. Looking for autoimmune issues like antiphospholipid antibody syndrome. Look for a septum. It sounds like you had a laparoscopy, but I'm not sure how closely they looked at the inside of the cavity. That would be important. Look at nutrition, look at your lifestyle. But at the end of the day, I think genetics, anatomy, and egg quality are the things that I would be looking at. And knowing that you have a history of endometriosis, I would want to make sure that you're also looking to see if you have adenomyosis. So ask your doctor, have you ruled out adenomyosis for me as well? So you can go and just print this stuff out. You have your list. Go and talk to your doctor. You're going to be more empowered than ever now about what questions to ask so you can be reassured about the next steps. But I would say in a 28-year-old who's had 2 miscarriages, lower sperm count, make sure you've done all the stuff that I just mentioned and consider IVF with genetic testing of your embryos potentially as a next step so that you can take advantage of your youth, your beautiful 28-year-old eggs. That's what I would do if it were me. Okay, so this next question is from Amanda. Amanda says this: I am kind of confused about all the advice about obesity and IVF. Do doctors have a BMI limit in order to do IVF? Should I take medication to lose weight before I do IVF? Okay, Amanda, so here's my general rule, and this is what I say. Your fertility is not skin deep. It isn't. So I think sometimes people wait and wait because they feel like they need to reach some sort of goal before they can even start treatment, and sometimes that just wastes time, and with the passage of time, we know that egg quality declines. There are doctors like me that believe in the fertility. I mean, I know this sounds cheesy, most of us do, of every person that walks in. Like, you walk in, I don't care your body size, I see you as a parent the way that you want to be a parent, and I will fight for you the way that you want me to fight for you. However, I can tell you that, every operating room has certain guidelines and rules. The operating room that I work in, the limit is BMI of 40. If you have a BMI of 50, I will work with you. I will build the team around you to help you get your BMI down to 40. And if you can't, there are centers, some not in California, that will take patients who have a BMI of up to even 50. Texas, for example, has fertility doctors who have BMI limits that are at 50, not 40. So right now with the pandemic, I don't necessarily want people traveling to do that, but if you need to, I want you to know you can. My goal is to talk to you about your lifestyle and what we can do to make it healthier. It's not about the BMI per se, but looking at everything, looking at all your metabolic parameters, looking at your glucose, looking at your cholesterol, look at how you're eating, look at how much activity you have each day, and then taking it literally 1 week at a time. I have patients that I say every Friday, I need an update. I want to know how you're feeling, how you're doing, how much you're moving, and then we can talk about where we're at and then how things are going. I'm kind of like their fertility cheerleader in a way, and that way I stay connected with my patient and I expect an update every Friday. So Amanda, find someone who's going to treat you in the same way, and there are a lot of us like me out there. I'm not the only one. Okay, this next question is from Andrea. Andrea says, "Hi, Dr. Aimee. I'm 34 with an FSH of 8.7, estradiol of 88, AMH of 0.2. I have no reason or obvious cause for DOR. My mom was 55 when she hit menopause, never smoked, no drugs. Both my parents and sister have autoimmune diseases. Do you think I should get my antiovarian antibodies checked? And if I was positive, how would that change my treatment? I have learned so much from you. Thank you." Andrea, yes, I would not only check anti-ovarian, I would check anti-adrenal and anti-thyroid antibodies. And the stuff that I recommend on this show, I mean, sometimes I talk about stuff and it's because anecdotally it's stuff that I've seen really work, and I've learned it from other people, or just trial and failure, and not failure, but just trial and trial. And when I say failure, what I mean by that is the stuff that I recommend doesn't necessarily work for everybody. But I think in a case like yours, I would also look at Fragile X. I would also look at chromosome analysis. I bet you've done both of those genetic tests. But sometimes just doing things like adding naltrexone, as an example, if you have antithyroid antibodies or anti-ovarian or anti-adrenal, can help with like how your ovaries respond to medication. I've seen it before. Like, I had a patient, for example, a follicle count of 3. I put her on the stuff that I'm talking to you about, and the next time she had a follicle count of 9, and similar age as you, similar story. And it's like, wow, like that's incredible. And that's the kind of stuff that I love seeing, because it just gets me excited to see how I can help each and every person that I touch in my life. So the other things would be HGH, all the supplements I talk about, like NAD, CoQ10, a really good prenatal with fish oil, vitamin D. Theranatal from Theralogics, for example, is one. You can use code TUSHY, all caps, surprise, surprise that it's TUSHY, for the PRC price. But I do think that at 34 with an AMH of 0.2, it is worth it to do IVF. It is worth it to do egg freezing. I know I'm biased, but I would definitely do what you can to preserve your fertility at your young age. Okay, this next question is from Emily. Here we go. "Hi, Dr. Aimee. I heard on a recent live Q&A that you have a magic calculator you use for patients. I'm 37 with an AMH of 1.14, 6 follicles, FSH of 6. How many rounds of egg retrieval do you estimate I need to have 2 live births?" Okay, so at 37 with 6 follicles, I'm going to say probably 3 IVF cycles to get 2 live births. That's what I would be open to. So assuming that there isn't like severe adenomyosis or severe sperm issues or severe endometriosis, I think that would be probably a very realistic estimate of what it might take. Could you get it all in one cycle? It's possible. Could you just nail it in 2? Yes. But I would say that be open to 3, because sometimes the stronger embryos are the ones that are not genetically normal, and the ones that are lower quality are genetically normal. And then let's say you have an 80% with a 50% embryo, for example, you might want to get that 3rd cycle done now at 37 rather than waiting until you're 39 or 40, when you might need more than 1 cycle to get 1 embryo that has normal chromosomes. So you see what I'm saying? Make sure you know the I of your embryo diamonds. EmbryoDiamonds.com for those of you who are like, what is she talking about? So the I is the implantation rate per embryo, so that you can go through the 3 questions with your doctor. So the 3 questions are, what do I want? What is it going to take? And am I willing to do it? So you are very clearly stating, Emily, I want 2 kids. You now know what it's potentially going to take, and now you have to say, am I willing to do it? But you can't answer the question, am I willing to do it, unless you have all the statistics about yourself, right? So you can't make a really good plan for yourself without all the information. And that's my goal in doing this show, is for you guys to know what questions to ask. And it's still surprising to me that I have people that say things like, I don't know my embryo quality. I didn't know that that was something that I could have. And it's like, you totally can. Like, you don't just walk into a diamond shop and be like, just give me a diamond and close your eyes and here's a check, right? Like, you find out everything about the diamonds, like the cut, clarity, color, all that kind of stuff, before you walk out of the store, and you get a diamond certificate, right? It's the same thing with IVF. We get these embryology reports that are like the equivalent of our diamond certificates that teach you everything about your diamonds, your precious cells, so that you can make the best decisions for yourself. Okay, let's go to the next question. This is from Julia. Julia says, what do you know about that's so cute. What do you know about premature ovarian failure? What do I know? Okay, a lot. I was diagnosed with this when I was 17, and I'm now 22. I'm still getting my periods and I'm ovulating. What is the best fertility treatment for my condition? So Julia, it sounds like you don't have that diagnosis. You have something else that could be decreased ovarian reserve. So look at your AMH and your FSH, and I would say preserve your fertility, preserve your eggs. And it's such a beautiful thing and a blessing that you have done something somehow to find out your fertility levels now, so that hopefully you can find a doctor like me who will believe in your fertility and the health of your eggs and preserve it. So I would recommend egg freezing. I'm going to make an assumption that you're not married at 22, but there are a lot of people out there that have met their soulmates. And not that you need to be married to have a baby, you guys. My mom says that all the time. She's like running around at 75. You don't need a man to have a baby. I mean, I have an amazing husband. I'm lucky that way. I talk about him all the time because I'm not home. So I get to talk nicely about him here, so he doesn't miss me. Hi, honey. He's not even watching. Anyways, moving on. So Jamie's question is, hi, Dr. Aimee. I've been scanning PubMed articles on egg quality, and there's pretty astounding research on something called putrescine. I don't even know if I'm pronouncing that correctly. I'm going to link it below. I don't see anyone talking about this, and it looks like it's not on the market as a supplement. What are your thoughts about it? And the studies say that periovulatory putrescine supplementation can improve egg quality in older infertile women. So Jamie, I need to have this question back on the next show. You guys, I'm going to be here again tomorrow. I'm going to look this up. I'm going to research it, and I'm going to come back. Because as you guys can tell, I don't read these questions before I come on here. I just pull them from the website. Actually, Paula does a really good job making sure that I get them all in a nice order. And I start reading them, and I haven't researched this yet. I clearly will not say anything unless I feel like I know something about it. So I'm going to do some research, and I'll get back to you tomorrow. So please join me again tomorrow, Jamie. Okay, this next question is from Maria. Maria says, hi, Dr. Aimee. I'm 29 years old. AMH is 6.72, FSH is 7. I did 2 IUIs resulting in a chemical and a miscarriage at 6.5 weeks. We did our first cycle of IVF, and we got 14 eggs, 13 mature, 10 fertilized, and just got word. We got 7 blastocysts. We got a 5AA, a 6AA, actually 5 6AAs, and a 5BB. Could you please explain the difference in the grading and which one you would choose to transfer first to have equal chances with each? We're sending them for PGS testing as well. What are the chances that most of them come back genetically normal? Thank you so much. Okay, so Maria, at 29 years of age, having 7 blasts is awesome. It's awesome at any age, but like at 29, you might actually get 7 blasts that could be normal. You could get 3, you could get 4, you could get 5, but each embryo probably has at least, I would say, maybe a 65% chance of being genetically normal at least. So I think that your chances are very high of you reaching your goals with this IVF cycle. And as far as what each of the grades means, I'm going to give you guys an embryo grading lesson real quick here. Each embryo, if they're graded with the Gardner criteria, comes with 3 scores: number, letter, letter. Okay? The number refers to how expanded or how fast the embryo is growing. And the analogy that I use is like, think of a kernel of popcorn, okay? And that kernel, the popcorn comes out, and every kernel is a little bit different, right? So if the popcorn's completely out, actually that really doesn't work. If the popcorn is completely out, then you can basically biopsy and freeze that embryo, and that embryo is at least a 3, okay? And then think of a little chicken coming out of its shell, okay? So as a chicken comes out of its egg shell, I should say, it's a 5. And when the chicken's completely out, the chicken's out of the shell, it's a 6, okay? Forgive me for using such lame analogies right now. Then we get a letter. The first letter refers to the cells that become the embryo. That's called the inner cell mass. And the second letter refers to the cells that become the trophectoderm or the placenta, okay? So that's embryo grading in 10 seconds or less. And we like the letters more than the numbers. And we like day 5 better than day 6. And we like the first letter to be an A more than the second letter to be an A. So what I mean by that is if you have an AB and a BA, we're going to pick the AB first. And if you, let's say, have an AA on day 6 and let's say an AB on day 5, ask your doctor. But in some labs, for example, like the lab that I work with, I'll choose the day 5 AB rather than the day 6 AA. Okay? So fun stuff. Let me see if I can find the next question here. Perfect. This next question is from Grace. And Grace says, "Hi, Dr. Aimee. I'm starting my first IUI cycle. Along with my prenatal ubiquinol, can I take pterostilbene and triniagen while on Clomid and Follistim? Thank you." So Grace, the answer is yes. I tell my patients, please take these supplements until you're pregnant. Talk to your doctor though, because I want to make sure I'm not interfering with any recommendations they have for you. Okay? This next question is from Leticia. "Dear Dr. Aimee, thank you for sharing your knowledge and your incredible energy with us." Yes, I do have a little bit of that energy. "I'm 38. My partner does not want kids yet. He already has 2. We've been together for 2 years. He's 49 and he thinks he's too old." Let me tell you, Leticia, all guys think they're too old. So I'm looking, not all guys, but you know what I mean, especially 49-year-old guys. It's not uncommon for them to think they're too old, especially when they already have 2 kids. So I'm looking at an option to go solo. And I'm not sure about what is the best option for me. To start IUI, IVF, egg freezing, I'm not sure. I already did egg freezing when I was 35. Good job, Leticia. And I got 8 eggs and 5 were frozen out of the 8. My AMH has always been low but stable for the past 5 to 6 years. And the rest of my labs have been normal, my FSH and estrogen. The only thing that's out of range is my DHEA, which is unexplained and super high. Questions are this: what should I start with? Egg freezing again and then go to donor sperm and do IUI to start, or go straight to IVF? I've been told with so few eggs I should not do PGS testing. Thank you so much for your advice. Okay, Leticia, here's what I would do. So you've been together with your guy for 2 years and he thinks he's too old. So I'm sure you guys have had these talks, but I would make sure you've also seen a fertility-minded therapist so that you can figure out what's going to happen once the baby's here. If you're not, let's say, legally married, then it's not like you can actually, I would say, talk to someone, a professional in, let's say, the legal department about stuff like using donor sperm and child support and stuff like that. Is he going to be the intended father? What I don't want, like, you have all the freedom in the world if you are not legally married to him to go solo. But what I don't want is for somehow you guys to separate after you've had a baby, let's say with donor sperm, and then for him to claim that he is the father when you didn't want, well, not that you didn't want him to be, you know what I mean? Basically what I'm saying, I don't want you to be fighting custody with someone, okay? So that's the thing. I think that Most people, when they get married and have babies, they want to be with their babies 100% of the time. Tragically, women sometimes get divorced. Divorce is very, very common. But I feel like if people had a choice, they'd want to be with their babies all the time rather than 50% of the time. So that's something that you need to think about. If I were you, I would get some parental rights paperwork drawn up. If this is your long-term partner, you want to just make it clear that you are the mother and he can't, let's say, if something were to happen to you guys, somehow, make you share custody with him. That's what I would do, number one. Because you can imagine, with all the years I've been in practice, I've seen a lot of stuff. And I don't want any of the stuff that I've seen to somehow affect you. And I want you to learn some of the lessons that I've learned through experiences that my patients have had so that you don't have to learn things the hard way, the way some people have learned. The other thing that I would say is this. You want at least one baby, I imagine. You've done egg freezing already. And it sounds like you're willing to go the IVF route. So I would say that's what I would do. I would create embryos and see what you can get now. That will teach us about what you have frozen. So that's one strategy. The other strategy is make embryos with the frozen eggs and see what you have there, and then see if you even need to go through another IVF cycle. So if the eggs that you froze when you were 35 years old are going to give you what you need, which means a healthy pregnancy, why put your body through more IVF now? The only reason to maybe freeze more eggs is if you're still holding out hope that your 49-year-old partner is going to want to father a child with you, with his sperm. So I get that. We all want our partners to be the people we hoped they would be. And when they disappoint us, sometimes we're still going to hold out hope. So it may not be ridiculous for you. Actually, it isn't ridiculous for anyone to freeze eggs in any type of scenario, but especially in this one. If you still feel like you're going to hold out hope that he might change his mind, I would say freeze eggs again in case he changes his mind. But my thought process is do IVF now while you still have the eggs. Consider thawing your eggs and creating embryos to see what you have. Maybe do another cycle of egg freezing if you still want to hold out hope that he's going to want to donate his sperm. Otherwise, girl, you don't need a man to have a baby. Mic drop. You just need sparkling sperm, and you can get that from a sperm bank without the hassle of dealing with custody issues. Okay, next question. I sound like a woman scorned, but I seriously have the best husband in the whole world. This is from Claire. Claire says, I recently completed an IVF cycle after 3 miscarriages. 14 eggs were collected, 12 were mature, 7 fertilized, and only 2 made it to day 3 before being frozen, and they stopped growing at a 6th cell. I'm 35. We're considering doing another round before potentially PGS testing if we have any embryos. I love your insights on what causes eggs to deteriorate between fertilization and day 3. Should we change our protocol from short to long? Is there anything else we can do for a better outcome? Thank you. Okay, Claire, at 35 years old, that's really hard because you hear the stories, especially on this show, of so many women going through stuff like this, and they're 39, they're 40, they're 41, they're 42, and here you are at 35 having this experience. So first of all, I want to say, I'm sorry. And second of all, I want to say, it does happen. So there are 35-year-olds out there that have these kinds of experiences, and I don't want you to give up. You're doing all the right things and asking the right questions. And I would go through your official reports from your last IVF cycle. I would ask your doctor, what do we learn about my egg quality? What do we learn about the sperm quality? Are there any extra tests that we can do? So some of the extra tests that I would do in a case like yours would be to make sure you've done a chromosome analysis, make sure you've done a sperm DNA fragmentation test, especially if you've had 3 miscarriages. There's something that I want to make sure we're not missing, and that's something like a balanced translocation. I would consider all the egg quality supplements that I always talk about on this show, and make sure you've done an AMH level. It sounds like you got 12 eggs that were mature, so it sounds like your AMH level is probably not going to be the issue. So I just want to get that as a baseline so you can feel reassured by it so that you know that you still have time. There's no emergency here. So consider all the supplements, the HGH, the sperm DNA fragmentation testing, chromosome analysis, like I've already said, and I would say try again. See if your doctor has extra tools in the lab that they might want to apply to your case. For example, Pixie. I don't know that calcium activation would be helpful in a case like yours, but just bring it up and have that conversation with your doctor to see if they think it would help. As far as protocol, I think that getting 12 mature eggs from 14 eggs is a great thing. I don't know that protocol would change things by that much. However, the fertilization being that only 7 fertilize, you have to wonder if there's anything else that they can do in the lab for us, like I mentioned, Pixie or using Zymote. As far as why eggs deteriorate, but as they grow, embryo quality is related to three things: age, genetics, and environment. So from an age standpoint, we know that your age is plenty young to have an embryo grow. From a genetic standpoint, we know some of these things are just in our DNA, and sometimes we don't have the answers, but looking at the most obvious stuff, like the testing I already mentioned, can help. The environment is something that we could potentially control through our body size, our healthy lifestyle, all the kind of stuff that I've mentioned, especially at the beginning of today's show. So I would look at those three things, and those are the three things that can influence embryo quality. And I think that there's probably a genetic reason why this is happening. But because you've had a blastocyst before, with the 3 miscarriages you've had, it sounds like there's still a chance for you to be successful with a blastocyst, but I wonder why those miscarriages happen and if that has anything to do with what's going on now. So that's why I always say, let your previous history guide you, and use each pregnancy as a lesson for us to learn from. And sometimes the lesson is doing the appropriate workup for what for what you're going to be doing next, and that is making sure you've done enough genetic screening. Okay, guys, I'm almost done for tonight. Thank you guys for staying on with me. I'm going to start at the top of today's show and just go through the live chatted questions with you. So stick around if you want to hear me answer these questions. First question is about the COVID vaccine. Would you recommend the vaccine prior to transfer? And the answer is yes. I would recommend the COVID vaccine. So I would recommend that you talk to your physician, talk about your specific situation, and see if they think that it is for you as well. This question is from Sahara Violet. I need to find tips to find joy. This is what I'm needing. So if you guys are joining right now and didn't join at the beginning of the show, I talked about quick tips for finding joy, like listening to music, connecting, finding human connections, finding your mantra, your deep breathing, and telling people you love them. I swear it helps. Next question is, does a PGS normal embryo trump its embryo grade? And the answer is yes. Unfortunately, unlike diamonds, right? So a diamond can be gorgeous and you go and you pay for it and you're like, this is a gorgeous diamond and it's like that bazillion dollars, right? Some embryos, despite them being totally gorgeous, on the inside, they're not going to be gorgeous, unlike diamonds. So if an embryo is beautiful, we can't assume that it's also going to be genetically normal. Next question here is, I'm 31 years old. I've had 5 failed IUIs, 2 failed IVF with tested embryos, 2 hysteroscopies, PCOS, I'm at the end of my ropes. I don't know what to do. What else would you recommend? So in a case like yours, I would also do the ERA test, the Receptiva DX test. Look at all your PCOS levels, so to speak, and make sure you've healed your PCOS, including making sure your testosterone is normal, your vitamin D is normal, your hemoglobin A1C is normal, all the kind of things that I usually talk about relative to PCOS. I would do that. And best of luck. Next question is from Jody. Why don't you recommend PQQ? You mentioned taking 300 NAD if you can handle the side effects. What are the side effects? It's not that I don't recommend PQQ. I think PQQ is fine. It's just that I don't want my patients to be taking a ton of supplements. If let's say, 3 or 4 things are going to work, don't add a 5th one or a 6th one or a 7th one. That thing. I just want to keep things as simple as possible for people. The side effects of NAD that you should watch out for are feeling tachycardic, feeling really nervous and a little jittery. So you can start off with a 150 milligram dose and then go up to 300 over time, or start with 300, and if you feel really jittery, go down to 150. Someone asked, what is dexamethasone good for? There have been some studies that show that it might help the ovaries respond better to medication. I use it in patients, for example, who have PCOS. I use it a lot in my ovulation induction cycles for patients who have a history of being Clomid or Femera resistant, and it works really well. Next question is, how many plasma cells in a biopsy need to be present for an endometriosis diagnosis? I don't necessarily use plasma cells. I said that with an accent. I use a stain called, I think it's CD138. Next question is, 6 weeks pregnant after an FET and forgot to switch estrogen patch after 3 days, changed on the 4th day. Any harm to supporting the pregnancy? And the answer is no, because there's a buildup still of the estrogen. So even though you took the patch off at the 4th day, you're already pregnant, and we know that there's still going to be estrogen around, so I wouldn't worry too much. Next question is from Minnesota. When checking the follicle count to determine if this month will be a good month for egg retrieval, what day does that normally happen? So if you're a patient of mine, I bring you on cycle day 1 or 2. If it's like a day that you can't come in, then sometimes I'll have you come in like 2 or 3 days before you're due to start your period. Someone is asking, why don't you recommend duostim? You mentioned you do luteal phase retrieval, but not 2 retrievals in 1 cycle. So Jody, I haven't had a good experience with that. I've definitely tried it, but I feel like for me, the follicle counts are what guide me, not to just accomplish something to accomplish something. For those of you who don't know what duostim means, it means your period starts, you do a retrieval, and then you start medications again for another retrieval before your period starts. So for me, if someone's ovaries are swollen, I'm not going to stimulate them again. It just doesn't make sense to me. So I bring patients in to decide whether I should do the duostim or not. I'll give you a scenario. Cycle day 1, you come in, you have 4 follicles, and then I'm like, your AMH is 0.6. I want to wait a cycle and bring you in maybe and see if we can do a mid-luteal start. You come in for your luteal start and you have 3 follicles. And I'm like, let's just wait until your period starts and see if we get at least 4. If we get at least 4, we're going to go for it. So that's kind of how I think about things. Next question is this. I'm 35, just finished my first Clomid cycle. My doctor prescribed 2 weeks of birth control pills followed by 150 milligrams of Clomid. I started my period 2 days after stopping my Clomid. Is this normal? So what I'm thinking is if your period started 2 days after stopping your Clomid, you probably made assistive ovulation while on birth control pills. Yep, it can happen. People can ovulate even on birth control pills. That's probably why that happened. That you ovulated, you took Clomid, you didn't know it, and then that's why your period's here. Next question is, at 42, I had 2 PGS normal embryos, but suffered a loss at 8 weeks and then failed implantation. Devastated, of course, now turned 44. Should I dare try again? AMH is 2.2, FSH is 7, all tests are normal. So Scorpio 1M, what I would say is this. You're young, you're 42. If when you're, let's say, 5 years from now, 47, let's say you had a baby through another way of creative family building, right? Egg donor, embryo donor. Would you look back and say, or adoption, would you look back and say, I wish I had tried one more time with my own eggs? Or would you say, God, I'm so glad I just moved on when I did and didn't put myself through more? If the answer is, I'm going to always wonder, so then I would say, no matter the outcome, do another cycle and see what would happen. At 44, though, you should be just open to the fact that, at this point, the likelihood of it working, each embryo being normal, is going to be 10% or less. The likelihood of even getting a normal is going to be low. But in someone with your levels at AMH of 2.2, FSH of 7, and you just had 2 normals at 42, even though they didn't work, I would say it makes sense. If you came in to me and talked to me about this, I would say, let's go for it. I'd be super excited to help you, but I would be talking about maybe using a gestational carrier or doing all sorts of testing before you transferred so that you can have a pregnancy with your own DNA if that's important to you. Next question is, I'm on the kitchen sink protocol with Lovenox, prednisone, intralipids, Claritin, pepsin, and my liver enzymes are elevated. Is this normal? And will my baby be okay? I'm 7.5 weeks pregnant. So I would say in a case like yours, if you're a patient of mine on all sorts of medications and they all can affect the liver, I would say stop them, accept the stuff that you really need. And sometimes people can have liver enzymes that are elevated from just being overweight. That's called fatty liver. It's not that uncommon in our society. So I don't know if you've ever had your liver enzymes checked before, but that just can be like where your liver enzymes live. So I would look at all your supplements. Sometimes taking a supplement like Chinese herbs, for example, can affect your liver. So I would stop anything and everything that isn't necessary right now. And see a GI doctor and make sure you're not missing anything else. Let's see here. Hi, Dr. Aimee. Is there a better sleeping position during the 2-week wait while experiencing bloating? So the best sleeping position is the one that you're comfortable in. So it's not like sleeping in a certain way would prevent bloating or anything like that. This next question is, hi, doctor. My clinic does the ERA with birth control pills, not sure why. If I have a stimulated transfer protocol, thanks. And I would say they do that for planning purposes so that your procedures are done probably on a day of the week that your doctor is available. So they use the birth control pills to plan your cycle. So we think about birth control pills as controlling birth, which sounds like, what? Like, why would you even do that? But we actually use birth control pills for fertility planning purposes. And sometimes it's for testing planning purposes, and that might be why. So talk to your doctor about why they're choosing that and see if there's anything else that they might want to consider that you feel more comfortable with. This next question is from Sheila. Hi, Dr. Aimee June. Curious to know why some embryos don't continue to grow or some miscarry at 7 to 9 weeks, even after having implanted. So a lot of that has to do with genetics, and it's not just chromosomes. There could be, let's say, an organ that's not growing normally, and that's why. It could be related to an autoimmune issue. It could be related to an infection even. But most of the time, when an embryo grows to 7 to 8 weeks and then stops, more times than not, it's related to the genetics of the embryo. Next question is this. I'm 29 years old. My AMH is 6.7. Retrieval was 29 eggs, 22 mature, 19 fertilized, 14 blasts, 7 normal. 50% normal seems a little low for my age. I've had 2 miscarriages because this caused infertility. So I would say 7 normals out of 14 blasts is like fabulous, and that's quite typical. I don't consider that low at all. I consider that to be great. So if your gut is that you might be missing something else, sometimes we think of IVF as the cure-all, and then you transfer an embryo and realize that you didn't fix what was causing the miscarriages in the first place. So be sure to talk to your doctor and say, have you ruled out everything that could potentially cause a miscarriage when we transfer this next embryo? So that would be autoimmune issues, that would be a uterine septum, a polyps, scar tissue, stuff like that. So I'm sure your doctor has already done all that stuff and talked to you about it, but if not, this is the perfect opportunity for you to talk to them about it. This next question is, I've been taking something called BASIS for years. I'm not sure what that is, but this is cool for me to learn about, which is pterostilbene and nicotinamide, which is a precursor to NAD. Should I also add NAD? And the answer is no. If you're taking nicotinamide, that's all you need. Next question is from Sammy. Hi, Dr. Aimee. Is there a better... Oh, you already asked that. I already asked that out loud. Is it possible that a woman's body will only accept female embryos? 4 failed and all male. And the answer is no. That's totally random, totally arbitrary, and a coincidence. The gender doesn't matter when it comes to implantation. And I'm sorry you've been through that. Good evening. What is the lowest follicle count a doctor would... I have a feeling it's like, what's the lowest follicle count you would consider for a patient to move forward with IVF with? And for me, is if there's a chance for 1 egg, I will help somebody if they want that chance, as long as they understand what the outcomes could be, right? I'm always going to say things in a kind way, but I'm not going to mislead people or sugarcoat the possibilities from the treatment that they do. Next question is, hi, Dr. Aimee. I'm 32 years old, miscarriage at 9 weeks in 2019. I just did a fresh transfer and it didn't work. Should we do the ERA before our FET? And the answer is yes, Jess, I would. Next question is from Allison. What are the male supplements and female supplements that you suggest? So I actually have a blog article all about supplements, so please go to my website, draimee.org, and look it up. But in general, for women, I recommend a prenatal like Theranatal. It has fish oil and vitamin D in it. I also recommend CoQ10 if you have an egg quality issue, NAD and pterostilbene. If you have PCOS, think about taking Ovasitol, among some other things that I recommend. And if you have endometriosis, think about adding NAC, N-acetylcysteine. For men, I recommend Conception XR, CoQ10, and vitamin D. This next question is this. I've had 4 treatment cycles, and a failed IVF. I think that there were probably 4 IUI cycles. They want to move forward with IVF number 2, but how do I know if I will be successful? So I think the answer to this is to go through all your official reports, sit down with your doctor, and just really break down your diagnosis and see what you've learned, and then talk about your IVF pyramid and what your expectations should be in a second IVF cycle. And the other thing that I like to talk about with my patients is, what would we do if we do the second IVF cycle and it doesn't work, right? Like, that can be very overwhelming to even think about. And you might be having these ants, I call them always negative thoughts, or another word would be like catastrophic thinking. Like you're thinking it, but you're not verbalizing it. So I think it's good to talk it out with your doctor, talk it out with a fertility therapist. And if you talk it out, it doesn't seem as big of a deal, because like the easiest thing to say is, I'm going to be a mother one way or another. That sounds really good and it sounds easy to say, but I really want my patients to believe it, because as long as that's something that you want, there are so many different ways in today's world in 2021 that you can achieve your goals. Next question is, could you recommend any nutrition expert? I had an inflammatory diagnosis and I would like to change my diet. Thanks. Yes, I recommend Judy Simon. Go to Mind Body Nutrition. She's out of Seattle, and she also hosts virtual sessions too, teaching you how to cook, like fertile foods, so to speak. And then there's also a website or an app, foodfuels.com, and the coach is Nina. I also really like a few other people. So there's a holistic nutrition expert. Her name is Nora Deborah. I did a show with her last week, so do catch that if you didn't catch it. She's fabulous. Other people, Dr. Sneha Kishore, Kishore. Her website is argo, ARGOW, health.com, and she is a functional medicine expert, and she also specializes in nutrition and inflammatory diseases. And then I also love, let me just think, oh my goodness, I can't remember. I did a show on gut health. Dr. Alex. She's fabulous. So she doesn't do telehealth consults unless you live in her area, but she has a fabulous website. And she has a podcast with Dr. Christine Marin. So those are all my fertile nutrition type of referrals that I'm calling out right now. Next question is this. I'm 31 years old, 5 failed IUIs, 2 failed IVF with 2 tested embryos, 2 hysteroscopies. I think I already answered that question, but maybe it could be similar to someone else's, but I would consider doing the ERA and the Receptiva. Someone's asking, how do I do everything that I do? Do I have kids? And the answer is I do. I'm very blessed to say that when I get home at night, I come in the door and I hear children running for me and attacking me. And I get home and I'm like, that's what I want for every single person I meet, because that's why I do what I do. Like literally, like that feeling is one of the most amazing feelings that any human can experience. And I'm going to start to cry because it's true. And I want that for every one of you. This next question is, hello, Happy New Year. I have a question. I'm trying since the last year, but did not conceive yet. All my reports look normal, but my doctor gave me Clomid for 2 cycles. It didn't work for me. Do I have any, and I think the question is any other options? And the answer is you absolutely do. I would go through the TUSHY method. Go to tushymethod.com. That's where you're going to find the 5 fertility tests that I think everyone should do before they start treatment. Or at least talk to their doctor about. You don't have to do them, but talk about them and see, like, if you're going to do certain treatments and let's say they don't work, does it make sense then to go back and do some of the testing that you can be doing? This next question is, I'm planning to start a new IVF cycle. My blood work for 2 consecutive months shows an FSH of 18 and 21. I'm 31 with an AMH of 1.2. My doctor wants to wait until my FSH level goes down. Please advise. So what I would advise doing is looking at your follicle count. Your follicle count will really tell me what the story is here. So I've had patients just like you. We go for IVF and I get 3 normal embryos. I get 3 blasts and every single one's normal. That can happen. Why? Because you're 31 years old. Don't let anyone tell you that you have the eggs of a 41-year-old. By the way, that's not an insult because, 41-year-old eggs can be good too. But I find that sometimes people use analogies like that can be hurtful and confusing for people, and it makes them feel like it's not worth trying and moving forward with treatment, when indeed it is, especially when you're 31. So someone's asking, how do you know your egg quality? And there are a few things that go into that. Your age, your FSH, your AFC, and your AMH. So I look at all of those things and then I can tell someone what I think about their egg quality. Allison's asking, how much vitamin D should you take? And my goal vitamin D level is over 40. So as long as I then tell patients to take 2,000, 4,000, 6,000, just kind of depends on what their where their vitamin D is at, and then I can make that recommendation. I'm going to finish up here in a second, guys, just because it's time for me to go home. So I'm going to be back here the rest of this week. I'll be here on Tuesday and I'll be here on Thursday. Thank you guys for joining me tonight. I'm going to hop and pop off, and I hope you guys will join me again. And I'll find lots of ways to entertain you guys and hopefully bring a little bit of humor into a really serious topic that sometimes is not that humorous, but laughing and can sometimes make something that's really serious feel not so serious and make you feel like everything's gonna be okay. So take care of each other, take care of one another, take care of yourselves, and find someone that you can call as soon as you're done watching this to say, I love you, okay? I love you guys, and I look forward to seeing you guys again the rest of this week. Have a great night. Bye, guys.